Student doctor. Patient with history of myocardial infarction. Patient is hemodynamically stable at present. Report the chest radiograph first.
This is a frontal chest radiograph of a skeletally mature patient. There is gross enlargement of the thoracic aorta. Large oval opacification extending from the right midzone to the base without obscuration of the vessels. Left lung is clear. Findings are consistent with either a leaking aortic aneurysm or a leaking thoracic aortic dissection. I would contact the admitting clinician and the local interventional radiologist as well as the cardiothoracic surgeons. The patient will require urgent intervention. I will also arrange an urgent CT scan of the chest.
Student doctor, can you explain findings on this CT study?
Selected images from a CT scan of the chest confirm the presence of a large descending thoracic aortic aneurysm with a moderate right hemothorax and small left hemothorax. The aneurysm appears to arise distal to the origin of the left subclavian artery, although I would want to review the CT scan on a workstation to confirm this finding. I would also want to find out the distal extent of the aneurysm.
Student doctor, how would a CT scan be helpful? Shouldn't the patient have immediate surgery?
The CT scan aids delineation of anatomy in the hemodynamically stable patient. The cardiothoracic surgeons would want to know the extent of the aneurysm, whether it involves the branches of the arch and the ascending aorta, and if there is aortic valve disease compromise. If the aneurysm arises at or beyond the origin of the left subclavian, it could potentially be amenable to endovascular stenting, thus sparing the patient an open repair. Obviously, if the patient is hemodynamically unstable, an immediate thoracotomy may be his only chance for survival.
This patient had successful endovascular treatment of his disease by an interventional radiologist. He was discharged from hospital shortly afterwards. Okay, good. We'll move to next case.